Welcome, everyone. I'm Don Liacono. I am the Chief Program Officer at NAMI Davidson County, and we're here tonight for a virtual education session, something that we try to do on a monthly basis. I believe last year we did over a dozen, and we have at least 34 recorded on our YouTube channel. I think tonight will be our 35th, and those go back to, I believe, 2022. But tonight we are welcoming Sammi King from Mamaya Health. She's going to be presenting on supporting new parents, an overview of perinatal mood disorders. So I'm going to throw the program over to Sammi. And again, please feel free to ask questions. If you need to, raise your hand, or you can put the question in the chat and I'll ask it for you. So Sammi, take it away.
Awesome. Is my screen sharing? Everything is visible? Awesome. All right. Kind of got to bounce between here to make sure that everything is flowing correctly. But as Dawn said, I'm Sammi. I am currently the VP of Clinical over at Mamaya Health. I am a licensed professional counselor and a perinatal mental health certified clinician. I'm an experienced psychotherapist and executive leader with almost 10 years working in the mental health field. I have experience working with clients that are in higher levels of care, including residential, intensive outpatient, and partial hospitalization settings, and have spent the past 5 years supporting the perinatal population and then leading a clinical team in outpatient mental health care. I am a mom to a sweet and very wild little 5-year-old girl and a chaotic yet sensitive 2-year-old boy. And I have been in recovery from an eating disorder for the past 12 years and also experienced postpartum anxiety with my first. Oops. All right. So today we are going to be walking through a lot of different things. By the end of this presentation, you should be learning an overview of perinatal mood and anxiety disorders, including important statistics, risk factors, and common signs and symptoms. We'll go through warning signs to determine if a loved one needs more support and what resources are available for them. And then we're also going to walk through some self-care and self-compassion exercises and some resources to reduce distress in the perinatal period. So we're going to have some concrete resources and activities, some things to really help guide you and your loved ones. So first, we are going to go over a brief overview of the perinatal mood and anxiety disorders. And for awareness, throughout the presentation, I'm often going to be referring to birthing people, women, and moms. The research uses the language of women and moms often. So please know that if I'm speaking of women or mothers, it's because this is what the research is on and the language that they use. However, I do want to acknowledge that this information and resources are for all birthing people, regardless of identified gender or parental identification as well. So maternal mental health or perinatal mental health. Why do we talk about this? Well, according to the National Institute of Health, perinatal mood and anxiety disorders, or PMADS, you'll hear me say the term PMADS a lot throughout this, are the #1 complication associated with pregnancy and the process of childbirth and the postpartum period. PMADS may be more common in certain populations, but they can affect anyone. And they have an impact not only on the pregnant or birthing person, but also those around them. So their fetus, other children, partners, and families are all impacted by the presence of a PMAD. 1 in 5 women experience a perinatal mood or anxiety disorder, and that statistic goes up to 1 in 3 for our BIPOC birthing people. Additionally, it's important to note that our Black mothers are twice as likely than white mothers to have a perinatal mood and anxiety disorder and are half as likely to receive care and services to treat it. We also see the perinatal mood or anxiety disorder present within the first 3 months postpartum for the majority, about 1 in 7 women. Additionally, 1 in 10 dads or partners also experience a perinatal mood or anxiety disorder, and they're twice as likely to experience it if their partner also has a PMAD. Lastly, I wanted to share some information about maternal overdose and suicide, as those are some of the leading causes of maternal death. Up to 80% of maternal suicides are deemed preventable, and overall, about 23% of all maternal deaths are related to overdose or suicide. These suicides most often occur around the 6-week period through the first year postpartum. So it's really important to note that we want to maintain this awareness after those immediate newborn days are over, because this goes throughout that first year as a potential risk. So when does a perinatal mood or anxiety disorder occur? First, I wanted to share some clarification on some important terms that you might hear either here or through the birthing world. So perinatal, that's one that I've already said it many times. It is the time frame from all the way from conception all the way through the first year of postpartum, so the first year of life. Some even see that perinatal period, including the first 2 years of life, as there is so much developmental change during that time frame. So prenatal would be during pregnancy or prior to birth, and then postpartum would be after birth, so up to the 12 months or up to 2 years. Up to 80% of women experience very common, normal, transient baby blues within those first 2 weeks following delivery. We're going to talk in just a minute about what that looks like in more detail, but just to know that up to 80% of women experience that. The onset of the development of PMADs varies, but as I said before, it's often within those first 3 months, which goes back to that statistic of 1 in 7 women experiencing a PMAD in that time frame. And then just additional awareness, the risk of onset increases anytime there is a hormonal shift. So birth, the end of nursing or weaning, the onset of first menstruation after delivery, and a next pregnancy, these could all increase the risk of developing a perinatal mood or anxiety disorder. So why should we worry about these? Why should we worry about PMADs? If left untreated, a PMAD can have a significant long-term effect on the birthing person, their partners, and their babies and other children and the entire family. This often leads to poor outcomes and increased risk for health and personal complications and extra stressors. So this includes physical stressors, emotional, mental, financial, and has social impact as well. PMADs are often grossly and highly underdiagnosed and undertreated as a result of many, many factors, including societal expectation, the pressures of being a parent, internal comparison and that internal dialogue, assumptions about parenting, the lack of access to care, financial burden, lack of awareness or just information regarding PMADs, and the lack of resources and information on treatment options. Nationally, about half of the people within the perinatal period with the diagnosis of depression do not receive the treatment that they need. So half. We know 1 in 5, so about half of those do not get the treatment that they need. Lastly, it's important to worry about and treat PMADs because of the costs associated with an untreated PMAD. The individual cost can include financial barriers, disengaged parenting, conflict with the primary partner, conflict with the family, and suicide. as well as the cost on the child, which includes attachment issues, behavioral issues, and developmental delays that can progress throughout childhood if these perinatal mood and anxiety disorders are left untreated. Additionally, the individual and national cost of untreated PMADs was found to be approximately $14 billion based on research from birthing people in just 2017 alone. $14 billion is the cost of the untreated one. So this monetary perspective really helps us to quantify the why behind why it's important to have PMAD awareness. I wanted to share some risk factors that you might see for a PMAD. We're first going to look at biological and psychological risk factors for developing it. So first, having a pre-existing mental health condition or substance use disorder increase the risk of developing a PMAD. And one study that was interesting found that about 60% of people that are diagnosed with perinatal depression were also diagnosed with a pre-pregnancy mental health disorder, and about 80% of those were anxiety disorders. I thought that was really interesting that those who 60% diagnosed were also had anxiety previously. History of trauma is a strong predictor of depression and mood disorders in the perinatal period or during pregnancy or postpartum. So one study indicated that women with at least one historical traumatic event had a four-fold increased risk of postpartum depression compared to women with no trauma history. Genetic predispositions and family history are other strong risk factors for developing PMADs, as well as pre-existing medical conditions such as chronic pain or other long-term illnesses. Those things all set up a person to have greater risk of developing a PMAD. The next one is pregnancy loss. Pregnancy loss is a life-changing and often very traumatic event that impacts a person's mental health. We know that up to about 20% of all pregnancies end in miscarriage or stillbirth, and that's of known pregnancies. Pregnancy after loss can then result in unresolved grief, increasing the risk of PMADs. So if somebody has experienced a previous loss and they are currently pregnant or birthing or postpartum, they have that increased risk because of that experience. Having a pregnancy that's high risk or has complications also increases that risk. So circumstances like carrying multiples, medical concerns like gestational diabetes or high blood pressure, fetal genetic disorders, smoking or drug use, and more can all make a pregnancy high risk, which again increases that risk for a PMAD. Medication changes. So if a pregnant person with a pre-existing mental health condition is currently being treated by medication, they may be advised by their doctor, depending on what the medication is, to either discontinue their use, either titrate down, or switch to a different medication that may be lower risk, just depending on the risk of harm to the fetus. So this adjustment, whether it's a discontinuation or a transition to a different medication, can cause a relapse of symptoms, which would leave a person more vulnerable to developing a PMAD. And then lastly, women who have unplanned pregnancies are 2 to 4 times more likely to suffer from postpartum depression. This might also include teens and young adults who tend to experience PMADs at a higher rate than adults that are 25 and older because of the underdevelopment of their brains, in addition to the unique situations and circumstances that exist while pregnant and postpartum, especially during teenage or young adulthood. Next, I wanted to share some of the many social and environmental factors that can increase the risk of a PMAD. Without an effective support system, birthing people may feel more lonely, they may bottle up thoughts and feelings, they may isolate, They might feel like they have nobody to talk to normalize what they're feeling or to challenge things that are unhelpful. So, having low support is a really big risk factor for developing depression or anxiety during pregnancy and postpartum. Marital conflict or conflict with the primary partner or co-parent can significantly impact a woman's mental health during the perinatal period, especially if somebody is in a current domestic violence or an unsafe environment. That creates distress that increases cortisol and really increases the risk of depression, anxiety, and trauma during that period. Financial strain and low access to resources are big risk factors. So, are low income or under and uninsured individuals, they're at a higher risk for PMAD simply due to the lack of insurance coverage for healthcare, their lack of available resources, available options for healthcare, and the strain that is on our systems that do provide those services for those under and uninsured individuals. They're so tapped out because there are lower resources. So those individuals have even less access. So they have an increased risk of developing a perinatal mood or anxiety disorder. And limited access, just in general, limited access to maternal health care affects 6.9 million women in just the United States, which is almost 500,000 births, uh, which is just wild. So 36% of counties in the United States are considered maternity care deserts, which means that there are no birthing hospitals or hospitals that even offer obstetric care within that county. Additional barriers with being in deserts like that are potential language and cultural barriers that exist within the mental or the maternal health care system. This can lead to feelings of being misunderstood and underserved, even when places may have options for translation. Sometimes they're not easily accessible. Again, just there might be things that are lost, literally lost in translation, that can really impact the mental health of these birthing people. And then, so that was speaking of maternal health care in general. Additionally, access to maternal mental health care is even more difficult than that access to maternal health care. It is estimated that there are 62 million birthing age American women, or 96% of the potential perinatal population, who live in shortage areas when it comes to maternal mental health. It's a lot. That's a lot of people who do not have access, who have just shortages of access to this specialized and important level of care. So I have, before I've already noted the increased risk for PMAD development with our BIPOC birthing people and racism and racial discrimination that exists within our healthcare system is a driving force for those disproportional statistics. We know that our BIPOC birthing and pregnant individuals often report feeling invalidated, not listened to, not taken seriously from their healthcare providers, which results in higher levels of stress, higher levels of anxiety, depression, and poorer health outcomes, and specifically poorer maternal mortality outcomes as well. Lastly, just a very common social or environmental risk factor is just the challenging adjustments that occur during the postpartum period. If somebody has a baby who is potentially has a difficult temperament, they might be really fussy, or they might have colic, or they might have feeding issues. Maybe breastfeeding is really difficult, is more difficult than anticipated. That can really lead to feelings of guilt and shame. I'm not being able to feed my baby the way I want to. Maybe there's an unbalanced responsibility between the birthing person and their partner. Maybe one is carrying more. All of those just adjustments of being new parents can increase the risk for developing a perinatal mood or anxiety disorder. Now that we've gone through some of those risk factors, I wanted to share a little bit more in depth um, what you might see from your loved ones, from yourself, from those around you. We're going to talk a little bit more in depth about the normal and expected baby blues. We're going to talk about perinatal depression and perinatal anxiety. So the baby blues is a term that describes a milder and more temporary form of postpartum depression. This means that the symptoms are very similar, but a less they have less impact than perinatal depression. Clients experiencing baby blues might feel like something's just a little bit off or not quite right, but those symptoms don't really impact their daily functionings or their ability to engage in self-care, go to work or school, manage day-to-day responsibilities or obligations. It's more so like, this feels hard. I don't like it. Something feels a little bit off, but I'm still doing what I need to do to take care of myself and to take care of my baby. As I had mentioned earlier, baby blues impact about 80% of new parents, which just goes to show how common and very normal this adjustment is. Those symptoms will typically present within days of birth and tend to resolve on their own within about 2 weeks postpartum, with minimal or no intervention needed. And a lot of this is just the hormonal experience of giving birth. There are so many drastic, very quick changes of hormones that make these baby blues very, again, very, very common. Um, Overall, while the person might be feeling distressed and uncomfortable and may feel sad or off, they're still generally coping when they are experiencing the baby blues. So this might feel like, or might look like, you might see an expression of sadness, feeling overwhelmed, feeling off or just not like their usual self, maybe not using their support system as much, maybe a little bit of isolation or just kind of trying to do it all in those first couple of weeks while they're still recovering from childbirth. Um, Less interest in socializing, just wanting to stay home. Again, this is very common in those first couple of weeks. Increased crying, increased anxiety, or stress in response to childbirth, or just adjusting to being at home, possibly some difficulty concentrating, or some irritability, or kind of snapping at their partner or their loved ones. Again, these symptoms are generally mild, temporary, and not debilitating. They're normal and almost expected or anticipated, and can be kind of planned for in those first few weeks postpartum. And the normalness of this is also why it's really important to have a solid postpartum plan of support so that that birthing person has the space to feel these things without them compounding into something bigger. So what would they compound into? What is that something bigger? Perinatal depression. So perinatal depression is a longer lasting and more impactful experience compared to baby blues. Symptoms are really similar, but they're going to be more frequent, more severe, and more persistent. They'll likely have some level of impact on that day-to-day functioning, such as being unmotivated to shower, unmotivated to brush their teeth, disconnecting from others, or just not feeling like they're able to accomplish those day-to-day tasks. You're going to notice a lot of similarities in the symptoms between perinatal depression and baby blues. And it's typically diagnosed within those first 4 months postpartum, with about half starting in pregnancy. And it affects about 20% of birthing people after childbirth. Again, that 1 in 5. Anxiety and panic are also very commonly experienced along with perinatal depression. So these are a common comorbidity, which means that they occur together quite often. Perinatal depression may manifest as the expression of overwhelming sadness, guilt, shame, worthlessness, or irritability, feeling lonely or disconnected, isolation and behavioral changes, excessive crying, difficulty concentrating, persistent indecisiveness or indifference, chronic or severe fatigue, suicidal ideation, or potential thoughts of harming baby, and increased negative self-talk. I also wanted to talk a little bit about perinatal anxiety as well. So perinatal anxiety is when a person experiences mild to severe anxiety, worry, or panic during pregnancy or in the postpartum period. These anxious feelings often feel out of control and they impair daily functioning. Similar to how perinatal depression impairs daily functioning, perinatal anxiety would also do the same. You would have that level of impairment in that day-to-day, not being able to accomplish your day-to-day needs. There's a lot of normalizing that can be done around a lot of the feelings of anxiety during the perinatal time frame, because being pregnant and becoming a new parent comes with a whole new world of worries. There are new stressors, new things to worry about, new things to consider, all sorts of things to think about that somebody might not have thought about prior to being pregnant or having a newborn. So there's a lot that is to be expected as far as worry and anxiety during this time frame. So it's really important and helpful to have a definition of what is that normal range for each individual, because to be able to see what is normal generally for their day-to-day experience, and then it can be really helpful to know that so that you can then determine what is not when it kind of goes outside of that norm. And it can also be really helpful to be able to determine then what type of extra support might be needed and when, and then yeah, it can help to kind of narrow that down a little bit when you know that norm. So when the anxiety goes beyond what they consider to be their own personal norm and they're no longer able to cope, again, this is an important point, is that like coping level, they're no longer coping effectively. This is when we would consider a perinatal anxiety diagnosis. As I shared earlier, there are also a lot of overlap of symptoms with the perinatal anxiety and depression, including crying, feeling overwhelmed, changes to sleep or appetite, concentration issues, irritability. And because of that overlap, as I said earlier, there's that comorbidity with perinatal depression. So perinatal anxiety looks like disrupted sleep, increased heart rate or heart palpitations, along with being unable to breathe or feeling shortness of breath, nausea or stomach aches, or the loss of appetite, muscle tension, jaw clenching, avoidance, so avoiding activities, people, or places, or just generally being overly cautious, racing, intrusive, or obsessive thoughts, feelings of sadness, fear, worry, and or guilt, difficulty focusing or forgetfulness, irritability or feeling really on edge, and panic attacks. So this is an image. In the audio, you'll have to check out the resource that has the pages with it, but this is a visual of really being able to differentiate and identify those symptoms of baby blues, depression, and anxiety. So you can see here in this visual that there are some overlap with all three. So this is why it's really important to recognize the severity and the impact that it's having on the person to determine those next steps for support. We can see it's a lot of ones that look a lot alike. I wanted to take a moment to talk through screening really quickly, because pregnant and birthing people often complete multiple mental health screeners throughout their perinatal timeframe. The screening and the use of assessment helps us to identify the moms and the birthing people who might need additional support and resources. So screening generally allows us to educate people about what is expected versus what are those pathological symptoms. So it helps us to see what is common and what needs additional support. Screening also can help moms just generally be more informed, supported, and resourced, which can increase the likelihood of them asking for help and actually seeking the support. When we have this regular education and information, it helps to empower women to be their own best advocates. And finally, screening can also really help validate and create goals that feel realistic and doable for the mom who might be needing additional support. So here we can see the standard screening recommendations for the perinatal population. So these recommendations are used widely across the country and they are pretty universal. So the first time someone is typically screened is at their first perinatal appointment. The provider is going to be looking to try and get that baseline understanding. So what is that norm of any possible symptoms or concerns to look out for throughout pregnancy? This is a really great starting point at that first perinatal visit. And then through the remainder of pregnancy, people are typically seen, they're screened for depression or anxiety at least once in the second trimester and then again in the third trimester. And then after birth, a newly postpartum person will typically see their OB provider or their midwife at 2 weeks postpartum and then again at 6 weeks postpartum, where they might be doing these screenings again. And then after this, the regular follow-ups for mom actually end. They shift to just as needed. They might transition back to receiving care from their PCP, or they might reach out to their OB if like an emergency arises, but otherwise, mom is kind of on her own. But additionally, moms will continue to do screenings. Our birthing people will have access to their screenings at their child's pediatrician appointments. So that shift kind of happens after those 6 weeks. And it typically, the American Association of Pediatrics recommends that we are screening our moms at 1 month, 2 months, 4 months, and the 6 month pediatric visits. So there's still continued screening, awareness, and hopefully the goal is and the hope is that those pediatricians are also resourced to be able to then provide access and resources for those people as needed. Unfortunately, it is not always the case. A lot of times we'll have screenings that are positive and our OB or our pediatrician is just like, well, here's a pamphlet. And that's where it stops. And the mom says, okay, well, this is too much. I'm not gonna reach out for help. I don't really need it, right? So why do we want to screen? Why do we have these screening processes? Why do we have these recommendations? Well, we don't want to just screen patients who we think might need extra support. We want to screen all pregnant and birthing people because sometimes people are simply unable to recognize their own symptoms or put to word what their experiences are, and it can make it more difficult to notice if it's a normal experience or if it is something that needs additional support. Lots of people also assume that their persistent sadness or their irritability are expected and normal parts of postpartum when that might not be the case. It might not be that their level of irritability is helpful or is expected, but it really is based on the level of distress and impact. Additionally, we screen and we want to really help and support people in getting these screenings and being honest in these screenings, but it's really hard because so many moms fear that stigma of mental health, being labeled as a bad mom, and maybe she might be even fearful that if she admits thoughts of hurting herself, maybe she had a scary thought about potentially hurting her baby, the thought might be, oh my God, I don't want to do this. Oh my God, what if I accidentally drop my baby down the stairs? But even just having that thought or saying that thought out loud or sharing that with another person, there might be that fear or that assumption of they're going to think I'm a bad mom and they're going to call CPS right away. My baby's going to be taken from me because I've had these thoughts that are here that I can't get rid of. How distressing. How hard to go through that, which is why we want people to have that support. So what does it sound like? So the screenings that we utilize, they can be kind of confusing the way that they're worded. The EPDS it's like the gold standard. It's wonderful. It is evidence-based. It's really, really great. And it can be confusing for some people. Um, so at Mamaya Health, we've been really working to humanize and make some of those screeners more usable, more easily understood, because again, they can feel confusing and hard to answer. Like a question of, I've been so unhappy that I've had difficulty sleeping. A mom might read that and think, well, I haven't been sleeping and I am unhappy about that, but I don't know which one happened first. How do I answer this question? Or things have been getting to me with answers like, yes, sometimes I haven't been coping as well as usual. Or no, most of the time I've coped quite well. But what if things have been getting to me and I'm also coping? Like, yes, I am. Yes, things are getting to me. I'm taking things personally, but I'm also coping well with it. How do I answer this question? So what we've done is created a really simple checklist of red flags that might help a person to identify if they need more support. So if a person is having these thoughts, it could be time to ask for extra support. So loved ones, if you hear a person sharing these thoughts, if they say these statements, then it might be like, okay, let's figure out how we can get you supported and held. So thoughts like, this is so much harder than I ever thought it would be. I feel really on edge, irritable, and like I'm about to snap at any moment. I'm constantly worried, even though everything is okay at the moment. I do not feel like engaging with my baby, even though I love them. I feel scared of the thoughts I'm having. I can't fall asleep or stay asleep, even though I know I should rest. I feel numb and disconnected from my partner or my support system. I can't enjoy my baby without feeling overwhelmed by my grief or thoughts of my traumatic birth experience. I'm feeling really out of it, confused, and I'm not sure what is real. And I think my baby would be better off without me. So if you have had these thoughts, or you've heard a loved one express these thoughts, then this might be an indication that additional support might be needed. And for some of those, it might be needed as soon as possible. We are going to walk through what that looks like next. So, what's next? We're going to walk through some grounding exercises that can support reducing levels of distress and grounding into the body. We'll learn about some self-care and self-compassion, and we're going to end with some supportive resources for treatment and additional support. This is my favorite part because I get to share some of my favorite tools. I wanted to share a few really concrete tools and techniques that you or your loved ones can try out if you need to, if you're feeling increased levels of distress. Yeah. So the first ones that I wanted to share are a few helpful distraction ideas. I feel like distraction gets a bad rep, but it can be really, really supportive, especially if you're feeling high levels of distress or have some ruminating, cycling thoughts. So list making or alphabet exercises is one of my favorite tools. So when a thought has been ruminating or cycling over and over again, or a feeling feels really intense at a time that you can't process it or can't honor it properly, distracting via list making can be super, super helpful. So you'll want to try something that is complicated enough that you can't do it on autopilot, but also not too complex that it becomes frustrating. I like to do things like listing fruits and vegetables in alphabetical order, or trying to think of all of the different dog breeds that you might know. Maybe it's naming the states in naming all of the states you can think of. But if you learned the state song that that as a kid, and you can recite it from memory. Like some of y'all know, like the Alabama, Alaska, Arizona, Arkansas. Like for me, I could never do that one. Yep, you got it, Ashley. I see. You like, yes, you know it. So that one might not be as helpful because it could just kind of go on a loop in the background and it would let those thoughts that are still ruminating come back to the front. So you'll want to try something that is a little bit more difficult so that it doesn't just become background noise. Next is a calm space visualization or taking a mental vacation. This can be a great way to distract from a current unchangeable situation and connect to just a moment of joy. Visualizing your calm space, letting yourself go to a different location in your mind. Cognitive shuffling. This is another fun one. It's really similar to list making. This is thinking of random words to shift the brain from the thought that it's stuck on. So, for example, if a new parent can't stop thinking about their baby's sleep to the point where it's interrupting their own sleep, then they can try to think of random words that start with each of the letters in baby sleep to try and shuffle their brain. So, baby sleep, B, banana, aardvark, baboon, yellow. There we go. Sleep, silly, lion, E. What words start with E? Excellent. Elephant, P. Procrastination. So when we start to kind of name those random things, it can really help our brains just kind of shuffle around, get back to the present moment, and it helps to kind of interrupt that line of thinking. So cognitive shuffling. The last distraction one would be to elicit a different emotion. This can be really helpful when you're feeling overwhelmed by a certain feeling. So this tool is utilized to utilize something external to elicit a different feeling. So if you're really angry, maybe it's watching a really sad movie that you know will make you cry. If you're sad, maybe it's listening to your hype up playlist to bring energy and excitement. If you're feeling worried, maybe it's pushing it further and watching a psychological thriller to elicit a startling fear to help reduce that ruminative worry. So it's really just kind of utilizing external tools to distract by eliciting a different emotion to change your emotions. And then some other grounding activities would be getting into the body. So I really love anything that kind of gets us to reconnect to the present, reconnect to our bodies. That can be a really difficult experience for someone who is either pregnant and is experiencing their new body for the first time. They're experiencing a body inside of their body, and it feels really weird and uncomfortable. So taking time to slow it down and just reconnect to the body can be really helpful in grounding. Body scans are a really great way to do that. So you kind of take a journey through your body, starting from the top of your head, slowly moving down your body, down to your feet. Just taking moments to stop. Notice if you can identify any tension, any pain, any discomfort. Just allowing it to be, not having any judgment toward it, just knowing, okay, I feel a little bit of tension in my shoulder. Okay. Okay, I can be with that. All right, I can know that. All right, I can move along. Um, one of my favorite but most annoying body scan exercises is the follow the itch meditation, which is I really love it because somewhere on your face or your body at this moment, there is a place that itches. Find it, notice it. Don't try and scratch it. Let it be, let it reduce, and let it move. It will move somewhere else, and you will be able to locate it and find the itch. It is so annoying, but it's really effective at getting connected to the body. Um, so if your brain is going 1,000 miles a minute, giving yourself the chance to slow down, find the itch, follow it, get frustrated with it because it's itchy and you don't want to itch it. It's a really fun one. Again, it's really annoying. Um, Progressive muscle relaxation is another really great tool. This practice helps us go through the body and slowly tensing and relaxing different areas of the body progressively throughout the body. So you might start with tensing and releasing muscles in your face, down to your arms, shoulders, stomach, legs. You can also do it by just tensing and releasing your hands. The way that this works is that it helps to release tension by creating intentional tension and then having the opportunity to intentionally release. So while we all might be holding normal amounts of tension, we might normally just hold it and we're like, ugh, I feel so much tension in my body. If we allow ourselves to like take that tension further and really, really, really tense the body and then actively let it go, it can really help to release some of that tension. And again, get into the body. Paced breathing is another excellent exercise to ground and get into the body. So a lot of these, it's paced, so you're counting the breath, you're holding, and you're releasing. One of the easiest ones to remember is just box breathing or square breathing. So you breathe in for 4, hold it at the top for 4, breathe out for 4, and hold it at the bottom for 4. This is easy. Practice it, slow down your counting as you get used to doing it. Sometimes this is also one that can be helpful to add a visual component to. If you have a pen and paper, you can draw those boxes while you're breathing and really get yourself back into your body and in the present. Superhero pose. This is a fun one because sometimes just standing like a superhero can feel physically empowering, and it can really help to shift the brain into more positive feelings and thoughts. So standing, hands on your hips, standing like you're empowered, standing like you're a superhero can really help kind of get into the body and get into that space. And then finally, just exercise and movement. Sometimes just moving your body, especially if you're moving your body with joy, whether that be walking, running, yoga, weightlifting, hiking, archery, whatever your way feels good to move your body can be helpful and can be grounding. This can be something that can be a difficult adjustment, especially in that postpartum period when, especially if birthing people are used to having a certain level of physical activity, this movement might have to change. It might have to shift. So they might be making adjustments in how do I move? How do I move in this new body? So that's one way that kind of reconnecting to the body, that can be a way to honor what my body has gone through in this period. Let me figure out how it feels good to move in my body now when they've gotten movement releases from their medical provider and have been cleared to do all of those things. I wanted to take a moment to just practice one of my favorite grounding exercises. So this one you can do anytime, anywhere. You don't need a lot. You just need your senses. So this one is called orienting, or the 5, 4, 3, 2, 1 exercise. This one, if you are someone who may not have access to all of your senses, you can adjust this. You can change this to make it work for you. So, I want to take a deep breath. If you are able, I want you to look around your environment or just take your environment in. I'm going to slow down our bodies and minds. And in your environment, I want you to see if you can find 5 things that you can see. Slowly find them. 1, 2, 3, 4, 5. Now find 4 things that you can touch. What's near you that you can physically, tactilely experience? 1, 2, 3, 4. Now, 3 things you can hear. Maybe it's someone downstairs. Maybe it's a fan. Maybe it's your dog breathing. Slowly notice. 1, 2, 3. 2 things you can smell. Maybe it's dinner. Maybe it's a candle nearby. Maybe it's essential oils. Find those 2 things. 1, 2. And 1 thing you can taste. Do you have something nearby? Sour candy is a good one. A mint, coffee. 1. Deep breath. That's orienting. One of my favorites, can be done anytime, anywhere, can really help to just slow you down and bring you back to the present. So again, those are some of my favorite grounding exercises. There are so many others, so many other resources out there. I wanted to share a little bit about self-compassion and self-care, some other really helpful tools to help support yourself and loved ones during the postpartum period. So we all hear and know how important self-care is. It's everywhere. You can't care for others unless you're caring for yourself first. You can't fill someone else's cup if yours is empty. Put on your safety mask before assisting others. But what does that actually mean? What does that actually look like? So, self-care in general is just the practice of establishing behaviors that promote health, well-being, and illness management. Engaging in self-care can help to minimize impact and risk of perinatal mood and anxiety disorders and can generally just help you feel much better in your day-to-day and can support healthy and effective coping. Things like quality sleep, exercise or movement, eating well, taking time for yourself, journaling, meditation, asking for help, and utilizing your support system are all really excellent forms of self-care. Pregnancy and newborn life in and of itself, and really just being a parent in general, can significantly impact a lot of these self-care items, but especially sleep. How do I improve sleep when the loss of sleep just kind of comes with the territory of being a parent? So something that can be helpful for increasing quality of sleep is exploring sleep hygiene routines, and identify any barriers to getting quality sleep. That's a really great place to start. Identifying and normalizing that sleep routine um, can really help to figure out what is realistic in this time period. Normalizing it's gonna change. Normalizing that like your sleep patterns are not gonna look the same as they did before having a baby. But exploring these habits that can impact sleep can be helpful to identify ways to increase the quality of sleep. As I had just mentioned just a little bit ago, exercise and movement, great ways to get into the body, great ways to practice self-care. And this can be a really helpful thing for our loved ones to be able to do for our moms, for our birthing people, is if a loved one can come and take care or take care of some of the things that are on mom's plate so that she has the time to engage in movement, to even if it's just going for a walk around the neighborhood by herself for a moment, like that can be really restorative. Um, It's also important to remember again those limitations of movement and especially with pregnancy, later pregnancy, and then during postpartum recovery. So it's important to remember that might change. That's going to look different. For each person, it's going to look different how they can move, how they can take care of themselves. How can they move and honor this new body after it just created a human? And it's not just for, again, PMADs, they have impact on everybody. It's not just self-care is not only for the birthing person, those around the birthing person also can have great relief and impact from engaging in healthy self-care as well. Hobbies, taking time for self, journaling, all of those are really great self-care. So it can be really easy, especially for new parents, to fall into those patterns of only attending to the needs of baby and only focusing on like, what does baby need? What does baby want? How do I take care of baby? So it's really important to take that time to also remember, like, oh, wait, what do I need? Oh, wait, have I eaten yet today? I've been so focused on feeding this baby. I haven't even had a moment to take a sip of water in like 3 hours. So it's making sure that we are taking that time to focus on self, take care of self, and take care of self in those other ways that are not just those physical ways, but those emotional, social, mental ways as well. For loved ones of people, this can look like, again, providing time for a person to go and um, engage in a hobby, bringing over a puzzle and like puzzling with the birthing person to give them something to support and say, like, I'll hold the baby while you do the puzzle, or if you want to switch off, or we'll play a game, or that kind of stuff. Any way to really honor the person, the birthing person as a whole person and not just a like, you were a vessel, you created a person, you created this baby that now takes all of the energy and all of the care. One really difficult part of self-care can be asking for help and actually accepting the help, leaning into the support systems. And it can be have such great impact for a person to engage in the type of self-care that comes from asking for help. We, as human beings, are biologically wired for connection. And especially during such a vulnerable time, like the postpartum period, staying connected to our safe people can be the most valuable way to practice self-care, is having those people, having those safe people in our corner, um, and asking them to be there. And then finally, practicing self-compassion is a really helpful component to self-care because there are so many changes and adjustments during the postpartum period. Maintaining kindness and care to self is so key when it comes to practicing self-care. Um, self-compassion, I love self-compassion. Self-compassion is a practice of kindness and validation towards the self. Dr. Kristen Neff, she is one of the leading specialists on self-compassion. She has wonderful, her website is plentiful of resources. She's got TED Talks and videos that are just, I've learned so much from just kind of learning and looking into some of the stuff that she shares. But so Dr. Kristen Neff, she's wonderful. She is one of the leading specialists on self-compassion. So she describes self-compassion as the combination of three crucial components: self-kindness, mindfulness, and a sense of common humanity, which I think is really important, that normalization and that common humanity. It's so common in parenthood to fall into a habit of comparison, of self-comparison, of self-criticism, of the abilities of how you're doing as a parent, um, which is the opposite of having that sense of common humanities, having that sense of like comparison is that contrast. And self-criticism is the contrast to self-compassion. So self-criticism, it activates the body's primal reactions to threats with a fight or flight response, which increases the cortisol, adrenaline, and it activates that sympathetic nervous system. And this activation, especially when it's regular and active, it can lead to depressed mood, anxious mood, It can also lower access to our coping tools. If we're always in that fight or flight mode, it's really hard to tap into those coping skills because we are living in our amygdala and our limbic system, in that reactivity system, rather than being able to tap into our prefrontal cortex, which is that logic system. So self-criticism also activates the problem solving and error processing parts of our brain, which in essence means that it takes a situation and it sees the self as something broken, an error in need of fixing. On the opposite side of the spectrum, self-compassion activates the caregiving and parasympathetic nervous systems, releasing oxytocin and endorphins into the body. We can activate this system through simple self-hug and by changing the way that we talk to ourselves. If criticism sees the self as broken, as an error in need of fixing, self-compassion sees the self as holding positive value and being worthy of care, compassion, and love. I did want to share a few misconceptions about self-compassion because I think there are sometimes people might see self-compassion as not being valuable. Some people might see self-compassion as being selfish or indulgent or a luxury that only some people can have because their other needs are met. But it could not be more than opposite. Being compassionate with ourselves first allows us to be able to take care of others better. And there's also no cost to self-compassion. So sorry if you can hear my 2-year-old. He is feeling some sadness right now. Feeling some compassion towards my little one out there. Um, there also might be the misconception that self-compassion means to be in denial or sugarcoating a situation. And self-compassion doesn't blind us to the reality of life, but it empowers us to utilize compassion as a new response to pain and suffering rather than our old responses, which would just prolong suffering, would just amplify the pain. Some people also might see self-compassion as self-pitying or someone just having a pity party. Self-compassion is not wallowing, it's not giving in, it's not giving up. It doesn't look at a situation in a way that says, oh no, why, poor me, but instead allows us to take an objective perspective on our struggles. It allows us to step back and see the common humanity. It allows us to take a step back and see what is objectively happening in this moment. And lastly, self-compassion may be viewed as being passive or lacking action or motivation for change or healing. Self-compassion does not enable passiveness. Instead, it actually increases motivation and time spent on ourselves and our growth. Some people might believe that we need criticism to feel motivated or to move forward, but actually, a self-compassionate approach challenges that idea, and it helps us to see that clear action can come with practicing self-compassion. I also wanted to share some helpful treatment options for those who might be in need of additional support. Again, we can practice these coping skills, and at a certain point, sometimes we lose that ability to access those coping skills. When our level of distress is too high, sometimes it can be too difficult to access those coping skills. So we need additional support to bring our baseline from being at a point where it's unable to access to a lower point where we can then access those coping skills. So many healthcare providers agree that the best form of treatment for mental health concerns is a combination of both therapy and medication. This is oftentimes, a lot of times, what I say to people is if you know the skills, if you know these are the things I could do, but I just can't get there, it's oftentimes it can be really helpful to talk about psychopharmacological treatment, which is psych meds. Some of these medications, such as SSRIs and others, might be helpful for pregnant and postpartum people that are experiencing depression or anxiety symptoms. Many of these medications have been found to be safe during pregnancy. And I also always want to say I am not a medical provider, so I always want to remind people it is always recommended to discuss any medication usage or changes whether titrating up or titrating down or eliminating anything like that, always, always discuss that with the medical provider. An OB or a midwife or a psychiatric medication provider with knowledge of pregnancy and postpartum would be an ideal resource in this situation. Of course, individual psychotherapy is an excellent option for many, which really gives people time and space to externalize their feelings, identify that norm. What is their norm? What is not? What are their warning signs? Helps to challenge unhelpful thinking and really just gives them the opportunity to feel seen and validated. Group, family, and couples therapy are all also excellent treatment options and can support that transition into parenthood and really help families all navigate that emotional and stressful time that can come with becoming new parents. Peer support groups. Peer support is a really wonderful treatment option for those seeking situations with others who are in similar stages of life. Peer support is also a really wonderful option for people who may not be able to access group therapy or couples therapy or even individual therapy or medication management. Peer support is really accessible, and so those who might be experiencing financial barriers, peer support groups are a really great way to find community and connection. And of course, higher levels of care for higher acuity needs. So this might include, but is not limited to, suicidal thoughts, self-harm, severe mental illness, psychosis or mania, substance use, or active eating disorder. All of those can be supported by higher level of care. There are oftentimes some things that may happen. Oh, sorry, my words just lost me. Mania, psychosis, or suicidal ideation, those are things that are medical crises in the postpartum period. So it's very important to ensure that a person is getting that proper medical care and seek services immediately. So we want to make sure that if you're noticing any of those thoughts of like, my baby is better off without me, or any excessive paranoia or delusional thinking, those things should be treated or should be screened for and then treated with haste because they can really become medical emergencies really quickly. So at Mamaya Health, we are dedicated to providing the highest quality of care to our beloved mamas and birthing people. So if you are interested in any more information for you or your loved ones, you can visit mamayahealth.com and you can check out, we've got a blog there with a lot of resources. You can learn about our team, or you can get scheduled directly for outpatient therapeutic services. Then lastly, I just wanted to share, oh, I didn't want to go that far. Okay. Lastly, I wanted to just share and include some helpful resources for our birthing people in need of additional support. We've got our National Maternal Mental Health Hotline, the Postpartum Support International Hotline, and then for those immediate crises, we've got our National Suicide Crisis Line and the National Domestic Violence Hotline. All of these have both call-in and text options, so they're really helpful resources. And then that's it. Thank you so much. I hope that this was helpful and informative. I'm open to any and all questions. Lay them on me.
I see Ashley's hand up. Ashley, you want to ask a question?
Yes, yes, I actually have a few. I've been taking some notes. This is all very, very helpful. Thank you, Sammy, for being with us tonight. I am curious of if you all have any research or any data on encapsulating the placenta to help with like postpartum. Um, have you heard of that, or do y'all have any information about that by chance?
Yeah, that is a great question. The only thing I can say is I have looked into it personally when I was in my own postpartum journey, but it has been 5 years since I looked up that. What I can do is we can absolutely look into some resources and get some information for you.
I would love that.
Sometimes, yeah, that can be.
I swear that it saved my life.
Oh,
Um, I did
particularly.
it, and I am just curious if there's actual like I would just be. I mean, I would experience some of those symptoms that you were explaining, um, and like early warning signs and stuff. And my spouse would hand me 2 pills of the placenta, and I would be like, "All right, let's do this," like. And so
Yeah.
I'm just curious if it if there's like if you all have information about it because I do think that it's an amazing resource for people that they don't realize is even a resource. And I know that a lot of people may think it's really strange and bizarre to take, and utilize those services. But I just was curious if y'all had um any research on it or if you all ever referred people for it because I think it's an amazing thing. I swear by it.
That's amazing. Thank you for sharing your story.
Yeah.
Yeah, I will
And
have to
then
look into more and see what I can find for you.
Yeah, and then another question that I have is for people that didn't birth the children but adopted at very early stages or like newborns.
Yes.
I'm curious if you all have any research about those types of like anxiety or mood disorders associated with, because yes, they didn't birth the children, but they are um, also experiencing similar things. And so just curious if they're treated similarly or if it's so if you have information about that, I'm curious.
Yes. Yes. Oh, that is a great question. So the adoption process in and of itself can come with so many obstacles, so many stressors, so much grief, potential loss. There is a lot that's there that could absolutely be one of those risk factors that we had talked about earlier for developing a perinatal mood or anxiety disorder. And you're
Mm.
so right. They're experiencing all of the same things, just minus the hormonal changes. That's the primary thing is like that would be different. They're still experiencing the transition, the adjustment period of having a newborn. Their lives are completely changed. And again, with a family who has experienced going through that adoption process, again, they're holding those
Mm.
months, years, for some decades of family planning and processes to get to that point.
Right.
And
And
so
like
that
loss
is
or pregnancy loss and stuff. Yeah.
great, absolutely. So absolutely, that is, yes, those things can present with the same kind of symptoms of perinatal depression or anxiety. And yes, we would absolutely support and treat those very similarly. We may even like have some more additional resourcing to support the the stress of going through that process. That
Mhm.
might be, yeah, you would
And
want
you
some.
all at Mamaya Health can serve those people still.
Yes. Oh, yes, absolutely. Yes, absolutely. Because we know that not all families are created by just a natural pregnancy. Like that's not how all families are created. Um, and so we really want to honor the path, the journey of all parents, of all, and again, not just birthing people, non-birthing people, new parents, the path that they took to become parents. Yes,
Mhm.
absolutely.
And the other thing that I was curious about is when you were talking about coping or methods for relaxation and for like grounding and stuff like that. Do y'all ever um, like is hypnobaby something that you all are familiar with and refer people to? Because I used hypnobabies to do a natural childbirth, and it was even postpartum, I was using my like skills that I learned in that. And so when you were going through those grounding exercises, which I loved, I took like a lot of notes because I think those are still very much useful, even for my child,
Yeah.
but I'm just curious because the Hypno Babies was something that was very helpful to me. And I just wasn't sure if y'all use that or know about it.
Yeah. So I will say, like, I don't have a lot of information around that specifically. I do know the impact of just mindfulness practices, meditative practices, like those practices absolutely are very, very supportive. I don't know specifically about hypnobirthing. However, I do know I know a lot of people and have heard stories of the impact of it. So what I will say is there are a lot of alternative um alternatives to therapy, I guess, but or just alternative care that has been found to be evidence-based and has research behind it. So I have not looked into hypnobabies to look at at least the like from my like nerdy like wanting to get into the research and see like what do the studies say? What does this look like? What are the scholarly articles here?
Yeah,
Um,
I
but
could
yeah,
see
that's
that
cool.
being something that could be incorporated as a resource in therapy, actually, because when we
Love
were going through the class, it was just incredible. And Kate Kropp is a good friend of mine, and
Kate.
and she, I told her about this. I asked her to send it on to her folks, but it was kind of last minute. But anyway, she says she sends referrals to y'all all the time, but I'm just like, it could be, anyway, it just is an idea because it just kept coming up for me being like, oh, and we could do hypno, talk to people about hypno babies and how to use it going forward. I use it now for shots, even,
Nice.
so anyway, that's all. Thank you.
Oh, I love that. No, that's really cool. I have a former colleague who is a hypnotherapist. So it just there are within the therapy world, there are so many vast numbers of just approaches and therapeutic orientations. Um, so yeah, that might not be one that I specifically use. I'm like I'm an IFS, like internal family systems and DBT, CBT kind of girl, um but yeah, that's really cool. Thank you. Any other questions, curiosities?
This is your chance, people. Well, I'll take that as a no. It was very thorough, Sammy. I do have a quick question. You may have covered this and I may have missed it,
Oh,
but
good.
you talked about guilt of asking for support, getting help as a new parent, as a new mom. When you spoke of possibly treatments going out of psych medications, is that where the parent has to make the choice whether to continue breastfeeding or not? Does
Ooh.
that come into the equation?
Yeah, that's a great question. So again, always speak with medical provider, but a lot of medications have been proven safe both through pregnancy and while breastfeeding. Um, so there are a couple of specific ones that have been found to be potentially harmful. However, we always want to, from my perspective as a clinician, on the clinician side of things, we want to empower the client or the person to identify like what are the risks of utilizing the medication versus the risks of not taking the medication. And oftentimes, just depending on the research, depending on the severity of the symptoms, utilizing the medication is much more effective than not utilizing the medication because the truth of the matter is baby is being exposed, and this is both pregnancy and breastfeeding, primarily more pregnancy. Breastfeeding is lower risk, but in pregnancy, babies being exposed to risk either way. Like babies either being exposed to a risk of utilizing a medication or they're being exposed to the risk of the untreated depression or anxiety and the stress, the increased cortisol levels that the body is going through, the increased adrenaline that the baby is being exposed to those things. So oftentimes the low chance of risk of utilizing a medication is a much preferred risk versus the risk of not treating
Okay.
the medication. Yeah.
Well, thank you.
Yeah, that was a great question.
All right. Well,
I
I
don't
do
know.
want before we close did you have something to say, Sammy? I'm sorry.
Oh, I was just gonna say also, like a lot of times, um, people will have their like specific medications that they go to. Like there are some that are more have been shown to be like safer than others. So if it's a new perinatal mood and anxiety disorder that came up right in postpartum rather than a pre-existing or someone who's already been on a medication, it sometimes is a different just a different medication regimen also. So it depends also changing if they've had a pre-existing condition, if they were on a medication prior to getting pregnant, versus if this is something brand new, they've never used medication before. Those also look different.
And always good to ask questions of your provider and do some
Yes.
research yourself. All right. Well, thank you, Sammy. Before we close out the evening, I want to let everybody know that the audio version of this presentation will be on our YouTube channel by the end of the week. If everyone here receives my Monday newsletters, a link will be in there on this coming Monday. But if you want to check over the weekend, you can visit our YouTube channel at NAMI Info and just look up the title and you should be able to find this. Also, all registrants will receive the digital copy of what Sammy presented tonight, her slides. I'll send that out after the meeting. And we're always, and this, Sammy, this includes you and Lindsay too. We're always looking for suggestions for future education sessions. I'll be booking for the new year soon. So if you have any especially mental health related topics you'd like to explore, please feel free to email me at outreach@namidavidson.org, and we'll definitely look into find a presenter on the topic. So with that, I want to ask everyone to thank Sammi King for coming out tonight, spending her evening with us. We appreciate the support she's giving to NAMI as a community partner, but we really do appreciate you taking the time tonight, Sammi. This was a very thorough presentation, and I know our members and the YouTube community will appreciate it too.
Oh, of course. I'm absolutely honored. Thank you for asking. Thank you for reaching out. Yeah, this is really great. Anytime that we can provide education, support, anytime we can do anything, if it helps one person, if it can help one mom, if it can help one person, oh, I get goosebumps thinking about the potential effect. So
That's the NAMI model too, each
yeah.
person. So we appreciate it, Sammy. So
Thanks,
I bid
Sammy.
everyone a great night. Thank you all.
Of course. Thank
Sammy.
you.
Good night.
Thank you.